So anterior hip replacement has really taken hip replacement by storm. Every year, more and more folks are getting trained in it, and more anterior hip replacements are being done. The concept behind HipAlign is, what if we could deliver a product where we're still able to use navigation and get rid of fluoroscopy? Advantages of that are huge. It's better for the patient, it's better for the OR team, and it improves efficiency and creates a lot more space in the OR.
The anterior approach product by OrthAlign brings every bit as high level of accuracy as what I've found from other systems, and a cost-effective model. In addition to that, it brings some new applications that I think are potentially even better than what's currently out there, as far as being able to accurately give us assessments as far as leg length and offset are concerned. This has been recently FDA approved. I've actually had the opportunity to utilize this in the lab, and I've seen that it works very well. I've been utilizing the OrthAlign hip product for quite a while now, and I've found that the cup positioning is very accurate. Essentially the numbers that we're shooting for, and then comparing that to your either intraop or postoperative radiographs, are very consistent. From that standpoint, I believe there's even data they've collected on some of the initial cases that have been done, not just by myself, but by other surgeons that have actually shown that as well.
So with the current use of fluoroscopy for anterior hip replacement, many times we get a little bit fooled by what we're seeing on X-ray. And the reason for that is twofold: pelvic tilt, pelvic offset. With HipAlign, we've taken these two things into account. We're basically navigating abduction and anteversion using the patient's individual pelvic tilt and offset. And what that does is it allows you a lot more accuracy of your number placement. Whereas sometimes when you're using fluoroscopy, you're getting a false sense of what those numbers are. For me, HipAlign actually produces a more accurate result than ocular navigation or fluoroscopic navigation. You think about over the lifetime of a surgeon's career, they're doing a lot of anterior hip replacements. That's a lot of fluoro exposure to the patient, the surgeon, and the OR team. We need to get rid of fluoroscopy. HipAlign's a way of doing that. In addition to getting rid of fluoroscopy, the expenses associated with fluoroscopy, and the time associated with increased fluoroscopy use, we're now adding efficiency and accuracy to cup placement and stem placement. So it's a winner all around.